Have you ever been given a medical diagnosis that you don't know what the future holds? I have. I was diagnosed with relapsing remitting multiple sclerosis. This is the second year I've been able to share my MS story with the first-year medical students at ATSU University. Let's listen as I share my story from diagnosis to the present.
What is a diagnosis, an autoimmune diagnosis? How does it change the way you think and approach your life? As well as what are the medications, what are the symptoms, right? What are the best ways to treat this, and all of the different factors that are part of autoimmune disorders. Okay, so without further ado, I'm going to hand the mic over to Carol, and let's get started.
Thank you so much. Thank you for allowing me to come and share my story. In 2004, at the age of 46, while I was attending cosmetology school, I started experiencing symptoms like difficulty hearing, fatigue, pain in my arms and legs, dizziness. I had blurring of the eyes, daily imbalance. I decided to check out my hearing, and I went to an audiologist who did a series of tests on me and came back with a diagnosis of a unilateral hearing loss on the left side. She said there could be two causes: one, genetic; number two, a tumor on the brain. She then referred me to a neurologist who I went and set up an appointment with, and the neurologist did some blood work and then sent me to an ENT doctor. That began my world of in and out of the doctor's offices. The doctor then performed a series of tests, which I did not enjoy at all, if you've ever had any of those tests done, and came back with the results that of negative, that I didn't have vertigo, there was nothing else of concern going on there. So I went back to the neurologist, and the neurologist said, let's do an MRI of the brain and the cervical area. They did the MRI. It came back of the brain an abnormal MRI. At that time, he said, let's send you to go have a lumbar puncture spinal tap. And that came back with 2 out of the 3 indicators necessary for him to give me a diagnosis of multiple sclerosis. I'm sitting in the office hearing that, and I'm thinking, what does that mean for me in my future? I didn't know what that was all about. I didn't understand it. All I knew was some of the different famous people on TV that have and had MS that have passed away now. And so I said it's important for me to get a second opinion. So I went to Barrow's Neurological Institute in Phoenix, met with Dr. Vollmer and Dr. Denise Campanolo. They went over my MRIs. That was in about December of 2004. They went over everything and said, we want to do another MRI before we make a second opinion for you. They sent me home with educational packets on Rebif, Tisabri, and Copaxone, and talked to me about taking Copaxone in combination with a statin. I went home and talked about it with my husband, and I'm like, wow, this is just all new. I don't know what this means, but I think I want to go with something that's least intrusive, which is Copaxone. So I went back in January and had an MRI of my brain with and without contrast, and I had, let me get this here, I had an MRI of my cervical and thoracic spine. What came back, the findings of my brain, was high deep white matter foci of increased signal flare in T2. These changes are in keeping with demyelinating process and MS-suggested lesions. My spine one came back with no lesions on it, so I was fine there. At that point, they felt confident to give me a diagnosis of relapsing remitting multiple sclerosis. My choice then was Copaxone in combination with a statin. I didn't know anything about Copaxone. I'm a wimp when it comes to blood and needles, but what I found out changed my world. I had to take Copaxone every day, which is a shot. I was going to have to give myself that daily. The Copaxone had to go into the refrigerator and kept refrigerated. Then I had to take it out to have it warm up before I could give it to myself. Now I didn't have just the regular syringe. It came in one of those injectors, but let me tell you, you still have to press that button. And you know how you can sit there forever until you press that button finally, and then it gets you. I had to do that every day. And not only did I have to do it every day, but I had certain places I could only give it to myself. My stomach, my hips, my buttocks. And not only did I have to change it, I had to change it out every day. I couldn't give it in the same place. Wow, this is what I had my whole future to do, and I was nervous, I was scared, I didn't know how this was going to impact me. I started giving myself the Copaxone shots, and certain places on me evoked emotion out of me that I never could imagine. So then I tended to go back to the same place in my stomach to give these shots, which would leave me with a bunch of hard lumps and not feeling the greatest. After a certain amount of time, I was like, I can't do this anymore. This is hard. This is a hard choice for me. And I was still having a relapse every 6 months. A relapse for me was when the fatigue in my legs and arms, my body, I was on a cane, I was depressed. I was already on 2 antidepressants, Zoloft and Wellbutrin, for depression for the last 10 years. I was suicidal. Life just wasn't a good place for me. And so I thought, what are some alternative choices I could have? So I went back to Barrows and I talked to the doctor. It was in 2005. And I said, what are some other choices that I could have? So at that time he said, why don't we start you in on the blind placebo clinical study? I said, great. He says, we have this new drug we're testing and it's in a pill form. I'm like, I can handle a pill. So I didn't know if I was on the drug or not, but that started the study. And it felt good because I felt supported. I would drive down to Barrows and I had my support team and I would go and I would walk and they would check how fast I'd walk, how fast I could run, my grip, and that started tests that I was involved in. And the tests were blood work, MRIs of the brain with and without contrast, brainstem auditory evoked potentials, visual evoked potential, CT scan of the chest with contrast, pulmonary function test. And I started doing that then from 2005 all the way through 2008. I felt supported. They would do tests on me. I always remember this, and I do this one still, is where I have to stand and put my arms out and pretend like I'm holding a box of pizza. And then I would close my eyes and they could tell me how my balance was. And I'm not going to do that now because my balance is horrible and I fall backwards. So that started being supported and being the clinical study. They took really good care of me and I felt that that was the best choice for me. In 2008, I was taken off of the clinical study because of some changes in my fundoscopic examination, which was looking at the fundus of the eye that was thought to possibly be drug related. So I was taken off the study, and I was probably on the drug. That was not a fun examination at all. So they took me off, and I thought, okay, now what? At that time, I was introduced by my brother-in-law to a plant-based diet that was 85% raw, 15% cooked. It was called Hallelujah Acres out of North Carolina. Did a lot of juicing. I thought, I'll try this. I could do anything right now because I am just really not at a good place and I want things to change. So I started that. I juiced carrots, spinach, celery, apples. I bought big bags of carrots from Costco and they thought I had horses and I said, no, these are for me. My body started going through a detoxing. I turned orange from all my liver detoxing. And so it was pretty funny walking around looking orange. And I started feeling better. I was like, this is good. Now this plant-based eliminated all animal protein, dairy, eggs, cheese, and I started feeling good. My husband went on the journey with me. It was a little harder for him at the beginning. He really enjoyed his salmon, and I enjoyed the smell of the salmon. But there's a saying in the recovery world that says, change doesn't happen until the pain of where you're at is greater than the pain of change. And my pain was great, and I needed to figure out what I could do to support me. And this was my choices. So I started this process. I started reading authors like Dr. Michael Greger, Dr. Colin T. Campbell, Dr. John McDougall, Dr. Neil Bernard, Dr. Caldwell Esselstyn, and Dr. Ornish, and they were all about evidence-based nutrition. This was all new to me, but I thought, I'm going to try this. So I went on this journey. Like I said, I just ate plant-based. And the more I learned, the more I try, because I'm one that will try things, because I want that experience. Because you can have all the head knowledge, but until you try it, you don't know how that's going to impact your body. So I started doing that, and I felt great. Now that was in 2008, I started that. 2008 I was off all medicine. I had one more relapse, and a relapse has to be a week to 2 or more of the same symptoms over and over. I can experience symptoms that are less than a week, but a relapse is a long length of time. So I had them come and do a home infusion therapy on me of steroid treatment at home. Those are great for stopping the relapse, but the side effects are horrible. Now, I forgot to tell you, with Copaxone and statin, they do have side effects. So I came in having all these symptoms. I had the side effects of Zoloft that I was on, and then I had the side effects that were possible on Copaxone. Let me just read those to you. Nausea, vomiting, chills, joint aches, body aches, neck pain, back pain, double vision, headache, increased urge to urinate, weakness, runny nose, swelling in your hands or feet, vaginal itching or discharge, fever, flu symptoms, sore throat, white patches or sores inside your mouth or on your lips, flushing, like warm redness or tingling feeling, chest pains, fast heartbeat, anxiety, shortness of breath, itching, dizziness, infection, mental mood changes such as depression, severe pain at the injection site, shakiness, tremor, vision problems. Okay, that was just Copaxone, and that's the least intrusive medication for MS. Statins, headaches, difficult sleeping, flushing of the skin, muscle aches, tenderness or weakness, drowsiness, dizziness, nausea or vomiting, abdominal cramping or pain, bloating or gas, diarrhea, constipation, and rash. Whoa, doesn't that sound exciting? I might have those on top of all my MS symptoms. So anyways, that journey, that was the best choice for me then. Now the best choice for me was trying this different way of eating. So I started embracing that. I started going to a biological dentist and having all the metals removed from my teeth and having my root canals cleaned up. I started seeing and having acupuncture done. I saw a chiropractor, was adjusted. I started wearing magnets. It was at the time that those were popular. That even helped me. I replaced all my pots and pans with a surgical stainless steel cookware. I started working on strength training and aerobic exercise. I love to ride my bike and walk. I started practicing meditation and deep breathing because a lot of stress that we get in our life starts residing in our body and can bring about illness. I also started practicing forgiveness because there were people in my life that had done things to me that were still resonating in my body in a negative, stressful way. And so I went through the process of forgiving. All those were a part of this journey that I went, and I call it holistic, Dr. T. Colin Campbell. It says WHOLISTIC, and that it's not just one area of your life that impacts illness. It can be a physical, that can touch the emotional, that can touch the spiritual. And so everything connects, and if you deal with just one, you're not dealing with some of those other things, and they start residing in your body. And you have to do things like yoga and things like that to kind of release them from your body. So anyways, I started practicing that. I started feeling better. In 2011, I went to Malawi, Africa to help do some helping a water well in a village with some medical communities, helping there. And that traveling internationally really sent me into a relapse. So I had another home infusion in 2012, I had one. Excuse me, let me go back. 2011, I was going to flight attendant school. Flight attendant school was very stressful. And I ended up having a relapse during the training and had to pull out from the training. That's when I had my second home infusion. After my second home infusion in 2011, I vowed I would not go through another steroid treatment because of the after effects was so horrible. So in 2012 is when I went to Malawi, came back, had a relapse, and said I'm not going to do that, so I'm just going to do resting and taking care of myself that way. 2012, it had been 4 years since my last MRI, it had been 4 years. I thought, let's go get checked out. So I went to Mayo Clinic and met with Dr. Jonathan Carter there. He went over my MRIs and he decided to do an MRI of my cervical spine with IV contrast and my brain without and with IV contrast. What it revealed is the cervical spine. There was no change in that. So from 2004 to 2012, there were no lesions on my cervical spine or thoracic spine. So that had not changed, which is pretty common with MS. It's usually primary progressive MS that has more of the lesions on the spine. Relapsing remitting has more of them in the brain. So the brain one came back and said the findings were little interval change in scan, none of the lesions demonstrate significant enhancement, no evidence of active or increased lesions in the interim since her last MRI. Woohoo! That's 4 years. Then I only had 3 relapses in 4 years. We're from 2004 to 2008. I had them every 6 months. So there was a significant change in there for me. So he then said, her labs do not suggest, because I said, now I'm on a plant-based diet. Please check all my blood work, and am I doing things right? Am I lacking anything? The findings came back that her labs do not suggest any secondary sources of fatigue or nutritional compromise, with the exception of borderline low vitamin D. I thought I can take vitamin D, that's not a problem, and I can get out in the sunshine more and walk. So I was really excited. That was 2012. Now, during that time in 2012, 2013, I ran the half marathon PF chain half marathon. In 2014, I rode the 19-mile bike tour. I was really enjoying life. I have been playing with my children. I've lost and kept off 25 pounds in 11 years. I've given up on and off of diets and counting calories. I just eat more good food, whole foods, plant-based. So I was really excited. Well, okay, so 2012 to 2019 is 7 years now. This summer I went on a trip, or 10-week camping trip. We have a little teardrop trailer, and I started getting dizzy. I'd wake up in the morning, and dizziness would happen, and I'd get kind of a spacey feeling. I'd start getting pain and weakness in my arms and legs, and it would last an hour to 2 hours. And it was happening almost every day, not quite. So we got back just this September, and I thought, okay, let's look at my holistic little circle here. What do I need to do? So I thought, first, let's see if I have any problems with my eyes. Went to an ophthalmologist. He says, well, you have a little bit of a change, but nothing significant to really warrant those kind of symptoms. So they changed my prescription. I got new glasses. They look good, don't they? And I thought, okay, so what's the next thing? So I met with my family doctor. I says, listen, I need to get an MRI done of my brain and spine and see if anything's going on there. It's been 7 years. I want to find out. So she said, okay. She ordered it. I went and got the MRI. It was of my, let me get this here, of my brain with and without contrast, in the cervical spine and the thoracic spine. The cervical spine, thoracic spine came back, no evidence of demyelination in the spinal cord. So, hey, since 2004, I've been consistent on that. So then the brain one came back. The findings were there are numerous demyelinating plaques in the supratentorial white matter. A few plaques have slightly increased in size since the previous study. There are no enhancing plaques to suggest active demyelination. And the lesion quant analysis demonstrates a total lesion count of 16, and they are distributed in a certain way in my brain. Okay, so I have something going on right now. I don't know what it is. So my next step is in January to go as a new patient and see a neurologist in Gilbert and find out what this means, because knowledge is powerful. So I'm going to find out what that means. What does that mean specifically for me? I'm not anti-medicine. If I need medicine, it's there for me. If I don't need medicine, then I can eliminate a couple pages of side effects on top of the symptoms I'm going through, which, for me, that's a positive thing. So I'm going to go check that out. Meanwhile, I asked for a lab order for blood work done to see if I'm lacking somewhere, which I've been doing with a holistic doctor, a naturopathic doctor, to sort of see what's going on there. And I've been seeing a chiropractor, being adjusted for some of the dizziness and what's happening. I'm still experiencing it. This morning I came, I have it. I have a real weakness in my body. So I don't know what's going on. But it's been 7 years. So if this is a relapse I had, That's been 1 in 7 years. So I've gone every 6 months for 4 years, from next 4 years, 3 in 4 years, to now 7 years, maybe 1. I like those odds, and I like not having to give myself shots all the time. I'm really excited at how the medical community has supported me and helped me in the choices that I can make to empower me in my journey. And I just keep wanting to share that there are a lot of different choices out there for all of us, and we get to choose what works for us. So thank you. I'll take any questions.
Thank you so much for coming in. It's really great to hear your story. I just have to say, I love that you take such a holistic approach on your health. I think it's really inspirational. How have you maintained, when you share your story, you have such a positive, power-filled attitude with it. How have you maintained that throughout your diagnosis and your own treatments and things like that?
That's a really good question. I think what's important when you have this kind of a diagnosis is a support community that you have around you. First of all, I have a very supportive husband that's very positive, very encouraging, and he does the journey with me. So I'm not by myself in changing some of my eating habits so I don't have to cook different for 2 people. He eats, and he has seen his own journey, how his health has been supported with it. But it's bringing around those people that are positive, they're supportive. You're still going to have some of those toxic people in your life that bring stress. And it's also learning how to have boundaries and be able to say no, because I learned that no is a complete sentence. It took me a while to really realize. But it's really setting things up. And it's called self-care. You really have to have self-care for yourself. And there's a lot of areas for that you have to go to, different levels of loving yourself, isn't it? Because we all have a lot of filters that we come into disease with. But it is setting up a very positive support system is important. Thank you.
You had mentioned that there was a family member that had inspired this kind of integrative or more holistic approach
Yes.
to your treatment. For us as future health providers, what do you recommend that is most valuable or was most valuable in inspiring you to choose that route rather than choosing the more medicative approach?
That's a good question. What I felt from the doctors in the medical community was listening to me and also asking questions about what's going on in your life. I think they took an interest in me, not just at the medical level, but just what is happening in my world. And I think in listening to me, they would be able to get a better understanding of maybe some areas that I needed to work on and could support me in that. But they listened to me. They didn't come at me like I didn't know anything, because we do have Google, and that does help me. But I just feel that they listened to me, and together they said, let's come up with a plan that supports you rather than I know more than you, and therefore here's what you need to do. Thank you. I think there's...
Hi, nice to meet you. The question I have is out of the context that my father also has multiple sclerosis, so I'm really curious to ask, out of all of the alternative treatment forms that you pursued, did you find any particularly very useful for you?
The alternative treatment, the most powerful for me, has been changing my way of eating. I think it has brought more life and health into my body than anything else. But I also believe, like I said, it works alongside of meditation, works alongside of forgiveness, because I could do all the eating right, but then if I didn't deal with other things in my life, I would still have that pain and stress resonate in my body in different forms. So you have to start somewhere. So if you start, for me, it was starting with my eating, and as I ate, and as I felt and experienced, and as I read and learned more, then I was challenged more in more areas of my life. And I'm not one to go, I'm not going to do it. I'm like, I want to get rid of this stuff. I want to be a victor, not a victim of it. Because a lot of times when you get together with patients that have MS, especially in some of these small groups, everybody's complaining, everybody's like, woe me, and you want to just kick them in the butt and say, well, then do something about it. thank you so much. I really appreciate being able to share this with you, and I really am excited of how your impact on your patients down the road are going to help them bring kind of a lifestyle medicine to where you look at not just one area, but the whole spectrum of what we all are going through as physical human beings on this earth.